Very good evening, friends. Meeting again in the session of Materia Medica. And since last two lectures, we are discussing the Aurum Metallicum from Allen's notes. We have finished only the constitutional aspect of Aurum Met, and in the last lecture, the psychological aspect of Aurum Met. And in fact, both are very essential in order to understand the patients in the OPD. Because whatever is explained in the Materia Medicas is the failed side of Aurum. The positive side of Aurum is not discussed in the Materia Medica. I give full importance to the Dr. Rajan Sankaran's Soul of Remedies for this remedy because he has explained the exactly opposite, the positive side of Aurum followed by the negative side of Aurum. One has to understand both the aspects because in OPD we're going to get Aurums in the positive side. Negative side of Aurum, very occasionally you met because those are the persons who are frustrated and who are totally syphilitic, never waits and tells you, yes, doctor, I want to commit suicide. These are the persons who directly suicides. They never comes to you for the reason. Reasoning is not there. So that's the very important aspect which we have to understand, and that's why we have to recognize the Aurum. And the Aurum is recognized with its positive aspects. We have learned that Aurum is the most industrious person who is most religious, always better by religious music, classical music, very conscientious, always finds faults with him, not with others. He is very anxiety conscious. He is very orderly persons, ambitious, goal oriented, never stops working unless and until his day's work is finished, very meticulous. The fastidiousness is expressed at the meticulous level, very particular regarding all those things. Comes to your OPD with all reports arranged in a sequence. Every visit, the details are there, and who talks always in the date-wise fashion, date-wise and even times. So this is very typical with the Aurum. And then when he fails, because generally he is the person who is always in a righteous aspect, and whenever there is injustice and whenever he is not getting followed by the others or someone blames him unnecessarily, the fail side of Aurum starts. Then he becomes gloomy, then he becomes depressed, then he doesn't want to live, and then he commits the suicide. So this is exactly opposite side. And this is what we have learned in last lecture. Now we have to go with the particulars. Before going into the particulars, I want to share one more case. A fellow, nearly about 45 years of male person who came to me with a very good appearance, very meticulous, having a big tira on forehead. And he came along with, he kept the file in front of me. He has taken the appointment and he came very exactly at the same time. So when I went through his whole reports, I found exactly the meticulous aspect of that fellow. Since whole prescriptions, last 10-15 years prescriptions were there arranged in a neat, clean manner, and the exact dates he has followed for the consultation with the physician earlier. He was just 45 and since 30 years of age, he was having the hypertension and for which his treatment was going on. The question aroused in his mind, how much time I will going to continue with these medicines, and that's why someone suggested my name and he came to me. So when I asked, what's your problem? He said, doctor, generally I don't have so much of problem. Previously I used to have headache, and when I was seen by physician, he said that you are having hypertension, and since 30 years of age I am having hypertension, and he had checked at that time all the lipid levels, etc. Cholesterol level was high. and they started the tablets, antihypertensive, and there's that anti-hemorrhagic or antiplatelet tablets, and those are going on, and it is continued since that time. 15 years I am on them. I expect I I thought, why I am not getting cured? So one of my friend who suggested your name, and I'm there with you. I expect the same from you. And there was a big conversation going on between me and him. He told everything. He said, sometimes I used to get the pains over there in the chest earlier, and I was what little bit worried when I was diagnosed of hypertension. I felt it might be of heart origin every time. And sometimes there is a sensation that my heart has stopped. That is the sensation I used to get off and on. So that was another feature which was very important in that fellow. He was having, when I checked his pulse, it was rather thick. It is thick, it indicates the arteriosclerosis, atherosclerotic changes which are there in the age of 45. And he was hypertensive since 15 years on antihypertensive. When I asked about the hobbies, he said, I'm having two hobbies. I want to read the newspapers. I'm a voracious reader. I like, but generally my reading is always related with the religious books. Second important thing, he explained that I want to listen the classical Indian songs. That was another aspect which he has to. Third thing, he was the businessman. He was following his father. They are having their own factory, and he is following the factory after his father. Father has retired, and he is following, and he was very particular regarding all timings, everything over there, rules and regulations, and everything was fine. There was nothing to worry about anything, but still he was very, very, very meticulous regarding all those things, and regarding his timings, regarding his rules and regulations and everything. When he has shown, means his study echo, it has shown that there is a fatty degeneration of the heart which has been explained over there, and he was on one antihypertensive along with antiplatelet. I have put him directly on Aurum Met. Clear picture of Aurum Metallicum was there. I have not added any other medicine. I have put him directly on Aurum Met 30. And I have given 6 doses on day 1, 3 doses, next day 3 doses. And I have kept him on Caliphosphoricum 6x in twice a day doses. This fellow, I have continued treatment nearly about a year or two. Gradually, his antihypertensive we have reduced. First, we have reduced is 1/4, then again after period of 1 month, again 1/4, and gradually we stopped it, and his blood pressure returned to the normal without any antihypertensive. Same was true. I have asked him to go for exercises regularly, and he was very particular about all those things. Whatever the diet I have told, he followed the diet very clearly because he was a very meticulous person. Whatever is told, followed exactly. And that's why he came out of all situation within span of year. Question was that why 30? 30 is very important in that case. LM is also good potency if you want to repeat it, but there was no marked pathology which was visible. So I have not utilized the LM. I have used with 30 because 30th is the potency where you expect results basically at the level of physic. He was having the problem of atherosclerosis. And that's why I have started with the 30th and just continued with 30th for many months, not daily, but after a month or two, I used to repeat the doses of 30th again. And he came out of the situation. So this remedy, we have to understand from all those aspects. We will go to the Allen's notes, and we'll see the particulars of Aurum. He starts, we have finished up to the last sentence, that is the oversensitive least contradiction excites wrath. like Conam, to oversensitive to pain, oversensitive to smell, oversensitive to taste, hearing, touch, etc. Now we'll go towards the headache. Headache of the people with dark olive brown complexion. They are sad, they are gloomy, gloomy म्हणजे खिन्न, taciturn, having a very, he used to talk very few words, mitobhashi, disposed to constipation, from headache from least mental exertion. This headache, it generally happens to be there wherever there is any stress. Generally, business worries used to produce this type of headache. Generally, overwork, over exertion used to produce the headache in Aurum Metallicum. So these aurums, they are having this headache associated with the constipation. So the concomitant is also there with the headache. Then he explains about the external head symptoms, that is the falling of hairs, especially in syphilis and mercurial affections. Aurum is antisyphilitic remedy. Syphilis itself has the destruction. The local ulcer of the primary chancre is always treated with mercurial preparations earlier, and that's why it is called as a mercurial dyscrasia. When it goes from that place inside, it is called as a mercurial dyscrasia, secondary symptoms of the syphilitic disease, and this is one of the important remedy. In the secondary syphilis, it is a mixed miasmatic picture. Now it never remains purely syphilis. Then psychosis comes in the form of condylometallata. Then the sora comes in the form of maculopapular rash on extremities or buccal cavities. So all three miasms expresses at the secondary syphilis, and during that time there is a falling of hairs, which is characteristic feature which happens to be there. Then eye complaints, see very important symptom. I have seen one case like this, two cases in fact, one of a hemiopia where he used to see only lower half of the body, upper half is not visible. This is a horizontal hemiopia. And I have seen one case, a vertical hemiopia. He used to see only the right side of the malo, not left side. That also one case I have seen in my practice. So he is explaining over there, hemiopia sees only the lower half, sees only the left half, right is not visible, lithium carbon lycopodium. Again, very important remedy. And these specifications are there only in homeopathy, not with any other pathy. See that this is the beauty of homeopathy. We have the symptoms up to this level. Syphilitic and mercurial affections of bones, that already we have discussed. It is a very wonderful remedy for osteomyelitis. The infection, the caries, the necrosis of the bones, and it reaches to the bones. Most deep penetrating remedy. One more remedy we have learned prior to it is asafoetida. There also we have seen the osteomyelitic changes. This is one more remedy which is having osteomyelitic changes. The caries. Where is the caries? Caries of nasal palatine, caries of mustard bones, nasal palatine, mustard bones. Then caries, there is a uzina. Uzina means nasal discharge. Otoria, discharge from ear. Excessively fetid discharge, that is very important, very offensive discharges. Caries with pains worse at night, that is syphilitic pains, always worse at night. Drive him to despair, causing him so disturbed that he wants to suicide, despair. Caries of mercurial or syphilitic origin. This sentence comes again and again. Asafoetida is mentioned in the bracket. Yes, that remedy already we have discussed just a week back. Having similar type of manifestation. Both remedies are having that osteomyelitic defects. And one has to understand this depth of the remedy. If you are thinking of treating the osteomyelitis, think of the remedy which has that penetration up to the bones. Belladonna will not going to do that. Even the sulfur will not going to do that. Because it doesn't have that strength to penetrate up to the depth, to penetrate up to the core. Bone is the most hardest tissue and most inner physical structure. Prolapse and indurated uterus, female genital complaints from overreaching or overstraining like podophyllum and restox. Prolapse from hypertrophy, very important, hypertrophied uterus like cona immaculatum. The fibroids which are there with the cona immaculatum. Aurum, generally, it is not purely aurum. Aurum muriaticum natronatum is a wonderful remedy for the fibroid uterus. Because there are, it is the natrum associated with the aurum. And that's why it is a wonderful remedy to tackle the fibroid growths. Menstrual and uterine affections with great melancholy. Long-standing menstrual problems, long-standing uterine problems. At that time, patient gets depressed, and specifically during the menstrual period, the pains are so severe, specifically aggravated at night, and they become so depressed that the suicidal thoughts comes in their mind. That type of depression, along with uterine complaints, is Aurum. The foul breath in girls at puberty. This is again one future. I have treated one girl who was having this and at the time of puberty, and she said that, doctor, I feel myself, I understand that I am having foul breath, and that's why I'm worried that how I can marry with anyone. That was her problem, and she was very perfectly recovered with this Aurum and Rustox, two remedies I have used in her case, and she was wonderfully recovered. Halitosis, Rustox is one of the important remedy, very important remedy. Sensation. Now he is explaining the heart symptom. Sensation as if heart stood still, as though it ceased to beat and then suddenly gave one heart thump like sepia. Very specific action on heart. And this sensation is very typical. Patient complains, doctor, I feel that my heart is stopped, and then suddenly it starts again. Misbits is the characteristic of Aurum Metallicum. You get those misbits over there very commonly. Violent palpitation, anxiety with congestion of blood to the head. This is very important. Congestion of blood to the head causing headache. So congestive headache associated with hypertension, associated with fatty degeneration of heart, associated with hypertrophy of heart. This is a wonderful remedy to be think of. Violent palpitation, anxiety with congestion of blood to the head and chest after exertion. Pulse is small, feeble, rapid, irregular, visible beating of the carotid and temporal arteries like belladonna and gluonine. But belladonna and gluonine are very acute. Here the question is not big acute problems. It is not acute headache of belladonna. It is not a so acute headache of gluonine because of sunstroke. It is the headache which is persistent, and it is because of hypertension which was persistent over there. It is because of pathology which has developed inside the heart, the hypertrophied heart. The heart becomes boot-shaped, big, pumping very vigorously. And that because of which the congestion of head happens to be there in aurum, producing headache. So every remedy has a different reason. Belladonna, it is such some acute excitement causing the belladonna to get the headache. In case of gluonine, it is sunstroke, summer heat. Gluonine gets the headache. The same congestive headache is there. So we have to understand and we have to differentiate all those things. It is not an acute remedy, it is a chronic remedy. See the pathology which he mentions regarding the heart, the fatty degeneration of the heart, like phosphorus. So pathologies are mentioned. These are the features which are there are from accidental proving of the remedy, or sometimes they are from the clinical experiences. They are added in the remedicas or repertory. So we have understood aurum since last 3 days. The aurum constitutionally how aurum is there, then how the mental psychological aspect of aurum, and today we have finished. These are the particulars which he has mentioned in by Allen, which we have taken into consideration. Now see what he explains about the relations. Aurum follows and is followed well by Cipilinum. Intercurrent is a very good cephalinum in aurum case. Always think of the cephalinum as an intercurrent in aurum case. Similar to Asafoetida, Calcarea, the Platina, the Sepia, the Tarantula, the Theridion in bone and uterine diseases. So, bony penetration in those remedies are there. Basically, the Asafoetida, Calcarea, Platina, these are very important regarding this. Sepia, Tarantula, Theridion specifically for uterine troubles. So, comparison, it is your duty. Gopalan sir, you have asked pain during coition. Is this remedy helpful? It is not, we cannot go with this particular symptom. We can, you can find it out over there, but it is not the only symptom on which you will directly give the Aurum Met. The patient should be Aurum, then it has a meaning. Patient should be Aurum. So whatever we have discussed regarding the Aurum state, if it is there, definitely. It never depends on particular symptom, that specific, because if you open the repertory, female genitalia, pain and coition after or coition during, there are many, there is a list of remedies. You cannot prescribe on the basis of that specific symptom. See the general modalities of the remedy. Aggravation. Aggravation in cold air when getting cold. So this is chilly remedy. Aggravation by dying down. Aggravation by mental exertion. Many complaints come on only in winter. So see, very specifically the winter aggravation, cold weather aggravation, this is wonderful remedy to be think of, chilly remedy Aurum. Amelioration is in warm air when growing warm in the morning or during the summer weather. So these are the personalities which generally are chilly personalities aggravated by cold and winter, ameliorated during summer and warm application. So this is a very deep acting remedy, very important. If you'll go with the boric and find it out, the action of the Aurum, it is nearly about 40 to 60 days. 50 to 60 days Aurum has the action. Very deep penetrating remedy. So we have to understand the depth of Aurum. I will suggest you to go with the Borix Mathematical. Just read the first few paragraphs before the mind is explained by Boric. Whole pathophysiology of Aurum very nicely elaborated by the Boric in his book. That will guide you to understand the depth of Aurum again. So the clarity about the Aurum will be there after reading that paragraph also. That is also a wonderful thing. I have already explained the Aurum in previous lectures. So my suggestion is that just go and listen the Aurum and its groups, Aurum group and its remedies. And all Aurums I have tried to explain over there, Aurum bromatum, Aurum iodatum, and all those in that, like in those lectures. So my suggestion to all of you, go through that and understand the Aurum as a group remedy as well as the particular peculiar remedies from the Aurum group, so that you will understand the depth of Aurum over there. So it's a wonderful remedy to, to be studied and applied in the practice. We will get the positive Aurums many times, and then I'm sure that you will not forget those things which we have discussed in today's session. So just recollect in brief, Aurum are very meticulous, very hard worker, industrious. Aurum are fastidious. Aurum likes the religious musics. Aurum feels better by music, specifically religious music, classical music. Aurum, they are the persons who, when comes to you, talks in the sense of, doctor, I have started the disease on 26 January 10 after at the 10 o'clock. I have started getting headache. They talks in such a manner. That is very meticulousness which you can see over there in Aurum. And then you will follow that. They are very particular, goal oriented, and they want to achieve something in their life, and for that they works very hard. But ambition is not so much marked. The meticulousness is hard working and to the point they works. Unless and until the day's work is finished, they will not going to stop their work. And then if someone never follows them, goes against them, then they become depressed, sad, gloomy, morose, and then the fail side of Aurum starts appearing. So this is what is the Aurum which we have discussed. So that's all for today. Tomorrow we'll start with some other remedy from the third year syllabus again. And these are very practical remedies which are helpful in our day-to-day practice. I think we have finished the A group of remedies from the third year syllabus. Most probably we're going to start with the B series. And B series, I think Barata is the first remedy, the exactly opposite to the Aurum regarding it, regarding the knowledge, regarding the memory and everything. So we'll start with that in the next lecture. So that's all for today. Thank you being there, and ask your friends to join so that they can also learn practical aspects of the remedy. Thanks a lot. If any query is there, we'll have. Otherwise, we'll finish the today's session.
Sir,
Yes?
sir, in case of carries,
No?
sir, what is the difference between asafoetida and Aurum Met?
Asafoetida and Aurum. Basically, when
Yes, sir.
you cannot differentiate at particulars. Particulars are rather difficult to differentiate. You have to understand the core of Aurum. At the general level, every remedy, it is very easy to differentiate. The mentality of the Aurum is absolutely different than the Asafoetida. Aurum is very well proved remedy as compared to the Asafoetida. We never get so much mentals in Aurum. Very few features in Aurum, very few features in Asafoetida, the mental aspect, which is rather marked with the Aurum. And that's what I am telling you. If you are going with the particulars, there should be very much characteristics, otherwise it will not going to give you the remedy. Because bony penetration is there with Asafoetida, bony penetration is there with the Aurum Met, bony penetration is there with the hydrastis. All syphilitic remedies you are going to take into consideration or having the action on bones and necrosis, caries. You cannot differentiate at that specific level. So it is always you have to take into consideration the whole case in order to differentiate one remedy from another remedy. So there is no, even the Asafoetida is having the night pains, the Aurum is also having the night pains. You're going to get similarity because both remedies are from the same miasm. Very specific, both are syphilitic, and both are syphilitic, that's why they have that much of penetration to reach to the bones. Okay?
Thank you, sir.
Okay, welcome.
Hello, sir.
Yes.
Sir, I have one question. Before some time, you explained one case. There was a pathology regarding heart, and you said you repeated potency 30 every month.
Every month, 30. This case
Yes,
only.
sir. My question is, sir, why 30? Why not increasing potency?
Open your Borix Mathematical if you have there, and open the
Okay.
heart symptoms. I'm quite sure my memory is good. Open there, I think what Borix has mentioned in the heart symptoms, he has explained over there, I think 30th potency. These are the stalwarts who have explained their experiences, and their experiences are very important in our practice. It is given in, it is mentioned in Borix Mathematical. This 30th is the potency which is which penetrates up to the level of heart. 200 is rather high, and that's why 200, if you go with 200, it is little bit more, and that's why the soft tissues, whenever you want action, the 30th is the better. That's what the Borix has might have thought, and I also utilized the same potency, and it has worked very nicely. And 30th to 3 or 6 doses, then after a month, after 1.5 months, I have repeated it again and again whenever needed. There is one more question by Dr. Rushali Kavle, how to differentiate Nux. Nux, Madam, Nux and Aurum, no comparison. Nux is absolutely acute remedy. If you see the action of Nuxomica in Borix Matamedica, it is 1 to 7 days. Aurum is having the action 50 to 60 days. Big difference. Aurum, Nux is the remedy from acute miasm. Very acute troubles, very superficial. Ambitiousness is very marked, goal-oriented, zealous, enthusiastic, very hasty, hurried, everything with Nux. Aurum is not like that. Aurum is very stable person, very stable. That is the big difference. Miasm wise is difference with the Aurum and Nux. My suggestion to you, again go through the Boric's first paragraph in Nux and Aurum. You will understand the core of the both remedies. It is wonderfully given by Boric. So that's all for today. Thank you.
Hello, sir. Yes,
Ah,
it is given there, sir. Aurum 30. It is clearly given.
yes, I'm sure regarding it, because those are the hints of given by some stalwarts. Everything, when you are reading the Mathematical, never forget what you are reading. See, I will tell you certain things. Cilicia, open the Cilicia in Borix Mathematica. In the I session, he has mentioned use 30th for months for corneal ulcer, corneal opacity. These are the hints one should not forget. Cilicia, eye complaints, corneal opacity, keratitis, he has written keratitis, corneal opacity, and in
Yes, sir.
order to,
Yes, use 30 potency for months.
yes, for months he has written. Then you open the natrum nose. Corays are dropping from the tip of the nose, watery, and again given use 30th. I, it should be. I'm damn sure about it.
Natramur, under
Natramur,
nose, it is.
nasal complaint, nose complaints.
Yes, sir. You use 30th potency. Yes.
Use 30th, he has mentioned. These are practical hints.
Yes.
He has given very nicely. That's what we have to learn. Barata Kab, what he has written at the end. Very important sentence. Barata is slow in action, bears repetition. That is the sentence which he has used.
Yes, sir. It is given at the end. Yes.
Same sentence, I think so. Barata is slow in action,
Same.
bears repetition.
Same.
So
Same.
when you are reading the Mathematica, always make a habit of reading it in such a manner that it will be helpful for you in practice. Every sentence has a meaning. Okay? So we'll stop over here and we'll continue with tomorrow with Baratas only. Okay? Good night.